Good morning, everyone. I'm Amanda Campen. I work with the Massachusetts Emergency Management Agency on public assistance for COVID-19. I just want to start off by thanking everyone for joining us this morning. In order to respect everyone's time, we have put everyone on mute. But if you have any questions, I strongly encourage you to use the chat feature, which looks like a conversation dialogue bubble button to put any, and I see there might be some people who cannot hear me. Let's see. I know Jeff said he can't hear me. Can anyone else not hear me or hear me? Okay, see Lorraine is saying, can hear me fine. Jeff, it might be a problem with your speaker. I'm getting a resounding thumbs up. I appreciate that. Okay. Nicole, see if you can reach out to Jeff to see if he has any issues, but we'll go forward. Jeff, and for everyone's information, this presentation is being recorded and will be available on the MEMA website, as well as all the questions that will be asked during this presentation and the corresponding response. So again, if you have any questions, please feel free to go ahead and utilize the chat function in order to submit any questions you may have. At this time, I'm going to go ahead and throw it over to Thad Ligmores, who is the Assistant Director for Recovery and Mitigation for MEMA. Thad, the floor is yours.
Thanks, Amanda. Yeah, thanks everyone for joining today. I don't want to take up a lot of time, so we can get down into the meats and potatoes of this. But as you all know, COVID has been an unprecedented disaster, both in terms of this is not what we typically do within the disaster world, nor does FEMA, and also in the sense that it is still an ongoing incident period, as we call it, right? So you're all aware that you're still incurring costs that are part of, that are eligible because they're happening during what we call the incident period. You know, a hurricane might have a 2 or 3 day incident period. Some flooding out west could be more, but this is sort of unprecedented. And as we face the surge, both at the state and local levels, we've been getting a lot of questions and outreach that are centered around planning for the surge and those kind of questions. So we thought it would be a good time here in December or before the holidays to do a series of webinars to try to get information out there and answer questions to the best of our ability. FEMA's on the call today listening. FEMA Region 1 has been a great partner to us in getting these PWs through as we get them in. And also our team, the state has, between MEMA staff and the Amanda and her team that have come on to us as vendors, you have a considerable staff of, all in total, about 40 or so people working behind the scenes to help you get your PWs through as quickly as possible. So I think the next few months are going to be busy for all of us. At the state, we're standing up another alternate care site and several regional homeless non-congregate shelters. So we are still in the thick of it, as you can imagine, and planning for the vaccinations is the next big thing, which much of that may be FEMA reimbursable as well. So with that, I'll turn it back and just say this is the first of several of these we're going to do into the end of this year, and possibly as we get into vaccinations into the beginning of next year. So thank you for joining, and I'll turn it back to Amanda and the team.
Thank you so much, Thad. Appreciate those words. I am seeing on the chat some activity about audio issues. I'm seeing some people have had success with calling in as opposed to using their computer audio. I also see some people having success with going into their settings and changing their audio. I would definitely suggest trying first calling in order to, not miss too much. But again, if you miss anything, all this is being recorded currently, so mind your P's and Q's. And we will be posting this on our website. So as we begin, we just wanted to give you an overview of the COVID-19 Major Disaster Declaration, but also to address some of your concerns that you may have regarding the coronavirus relief funding and how it interacts with the FEMA Public Assistance Program. You're all municipalities and local governments that are currently on the call, which is very convenient. Most, if not all of you, have received some form of coronavirus relief funding that's currently being administered by the Executive Office of Admin and Finance, ANF. You may have concerns regarding, costs that we all know that the costs have to be expended by the end of this year, 12/31, for the Coronavirus Relief Fund, CRF. You may have concerns regarding how do I, show that those costs are not going to be eligible for public assistance so that you can seek CRF funding at the end of the year. You also might have concerns that after the end of this year, if FEMA denies your costs, what are you going to fall back on? So to answer your first question, if you have costs that you believe will not be PA eligible and you want to seek CRF funding for, please contact your MEMA project coordinator. That's either going to be myself, Robert Hanley, Michaela Velarde, Joshua Rosales, Joyce Waters, Sapna Patel, or Michael Materia. Just send them an email with the costs that you believe are ineligible and you want to seek CRF funding for. They will write you a memo in response, doing an analysis on those items, and will provide you insight as to whether or not those costs will more likely than not be eligible. And you can use that email to go to ANF to show support that those costs will most likely be deemed ineligible. So that's the first part. The second part, if you are concerned that the costs that you are going to seek funding for after this current year, after December 31st, will be denied by FEMA PA, your MEMA project coordinators will continue to work with you in order to prepare the best package possible to defend against any scrutiny. There's also an appeal option that we will walk you through as well. But we don't know what the future holds. If we had crystal balls, I'm sure we would all be millionaires. There might be additional funding that comes down that's similar to CARES Act. Not sure, but when that happens, MEMA and ANF will be here to work with you in collaboration to make sure that you have all the information that you need on how these two funding sources intersect. So again, if you have any questions on CARES Act funding, CRF, and how it interacts with PA, I do encourage you to utilize that chat function, and I'm seeing you guys are doing it right now, gold star, and we can address those at the Q&A. So just some high-level information on this major disaster declaration. So every state for each disaster gets what's called a disaster record. Which is a DR. For the Commonwealth, for the COVID-19 major disaster declaration, that DR number is DR 4496. And it was declared by the president on March 27th. All counties were included in this declaration. So if you're a local government anywhere in the Commonwealth, you are eligible for public assistance, which I believe is the first time this has happened in Massachusetts. However, as opposed to snowstorms that we've had in the past, not all categories of work is going to be deemed eligible for public assistance. In fact, only Category B is going to be deemed eligible, which is emergency protective measures. We'll get to Cat B and emergency protective measures in just a sec. As Thad mentioned earlier, this disaster is ongoing, which means there's not a deadline in sight. You can claim costs going back, all the way back from January 20th, 2020, going forward. We currently do have a cap on estimated costs that you can claim going to the end of the year. Once we reach that end of the year, MEMA will be evaluating that cap going forward and how much further it's going to go into the new year. So for time extensions, we do not need any time extensions at this time. I do realize that some of your grants portal timelines are going to look a little bit wonky. Ignore that for now. You do not need to submit a time extension via grants portal. As of right now, this is an ongoing disaster. No time extension is needed. When time extensions are needed, we will be providing you ample notice to get that done. So just to go into the agenda, first we'll be going into the FEMA Public Assistance Program, just some high level, things to know, especially for this disaster. Second, eligible activities and costs. This is going to be very important, especially for those who have received CRF funding. And then the required documentation that we will need for all of your projects that you submit for public assistance. So with that, let's begin. So FEMA Public Assistance, what is it? I know a lot of you are first-time applicants here, so this might be, so if you're, a more sophisticated applicant, you've done this before, this might be a little repetitive to you, but public assistance is administered through, is funding source through FEMA, and it is administered by MEMA, and it's to provide financial assistance to states, local governments, tribal governments, and certain nonprofits for their response costs for COVID-19 in order to ensure that your budgets aren't totally maxed out, that we want to provide you funds so that you can continue responding to COVID-19. The drawback, or one of the drawbacks to this program, is it does have a cost share. So what does that mean? Let's say you're able to justify $1 million in eligible response costs to COVID-19. And you're able to provide the documentation for, the entirety of that $1 million. FEMA will only pay $750,000 of those costs, meaning the 25% will then be the non-federal cost share. For this disaster, the Coronavirus Relief Fund is an option to utilize for that 25%. But otherwise, you will be responsible for that 25%. Now, just to make sure everyone sees that nice bold paragraph at the bottom, FEMA will not duplicate any assistance that's, administered by DHS, CDC, or any other federal agencies. So this is really important for those who have received that CRF funding. What does it mean? It means that you guys need to make sure that you are not claiming the same costs in both programs. You want to make sure they are very separate. You want to make sure that you are not claiming the same PPE in both programs. Now, what exactly is emergency protective measures? It sounds very broad, right? You don't really know what it is. Well, the statutory definition is an activity undertaken to eliminate or lessen an immediate threat to lives, public health, or safety. Just sounds broad, right? What is it? Not really. That sounds like everything under the sun can kind of fit into that definition, right? So let's take a deeper look as to what specifically is eligible for Cat B for this disaster. So for each disaster, or most disasters, FEMA will issue disaster-specific guidance that really is meant to help applicants navigate through public assistance and help you guys determine or figure out what's going to be eligible, what's not going to be eligible, what you guys need, and all that stuff. For this disaster, there's been a lot of fact sheets issued, everything from emergency medical care to emergency feeding. I would encourage you guys to go into the FEMA website and peruse those fact sheets. But the two main fact sheets or guidances that we're working with for this disaster are going to be two generalized fact sheets on emergency protective measures. The two guidances are different in that they cover different periods of time. So the first piece of guidance covers activities that were performed pre-October 15th. And then the second piece of guidance is activities that were performed after October 15th going forward. So I know a lot of you have had, a lot of questions between the differences between the two guidances, what exactly is covered, exactly what's not. Before we get into it, just, my thoughts on it. The first set of guidance is rather broad, rather vague, which is frustrating. I know, and it is frustrating for a lot of folks. And then the post-September 15th guidance, a lot more specific, tightens it up a lot more. The main difference between the two guidances is cleaning. What's going to be eligible facilities for cleaning, and what we are seeing get denied or questioned by FEMA. So let's get into the two separate guidances. So pre-September 15th, and this was the guidance for pre-September 15th, and this was issued and excuse me just one second while I close this door. I'm grateful everyone is working, or most people are working from home, and hopefully understand the issues of working from home as much as I do. So this guidance was issued rather early on in the disaster, and it's vague. However, some of the basic FEMA, foundations are still here and still apply. So in order to be reimbursed for these costs, you must have the legal responsibility, and it must be an eligible emergency protective measure to respond to COVID-19. Loaded statement, right? What does that mean? So the first part, you must have legal responsibility. Most likely not going to be a problem for you guys as municipalities. We definitely get into the legal responsibility question more so when we're talking about private nonprofits and whether or not they have the legal responsibility to do the thing that they are currently doing in the COVID-19 environment. So that includes, emergency feeding operations. Do private nonprofits have that legal authority? FEMA has deemed that activity, along with several others, are the legal responsibility of the government and not the private nonprofit. So just something to think about there. Not going to be a huge issue for you guys. Definitely going to be a larger issue for the private nonprofits in your community. And must be an eligible emergency protective measure. So what is that? So the eligible emergency protective measure is going to be all these things in bullet points here. So let's go into it. Let's go into each one a little bit first. Management, control, and reduction of immediate threats to public health and safety. If you're running an EOC, those costs are going to be eligible. The overtime you incur, your staff incur running that EOC will be eligible. Any meals you've provided, increasing utilities, office supplies, that kind of thing will be eligible. Training specific to the declared event, that's been a lot more geared towards health training or training of public health officials to make sure that they are disseminating correct information. But we have seen other trainings, like trainings in reporting systems or GIS systems, also go through and be deemed eligible. Disinfection of eligible public facilities. Now everyone got real excited when this guidance came out, saying, "Oh, we can disinfect everything. We can clean our schools," and that's what was needed, right? That was what had to have happened in the beginning of the disaster, when all the schools were open, town halls were open, places where the general public trafficked in and out of day in, day out. FEMA has determined that in order to be an eligible public facility, that facility has to, you have to be performing eligible emergency work out of that facility. So that is not going to include your schools. That is not going to include your town halls or your, whatever buildings that you do normal routine town functions out of. That's really only going to include, your EOC ambulances, your EMS corps, your police stations, fire departments, if they are performing, response activities for COVID-19. That's going to be the key there. Are they doing response activities for COVID-19? Now, we have seen, for those that are freaking out, schools and your public, your town halls, I'm sure they got cleaned. I'm sure they were, you had to clean them and all that stuff. FEMA is allowing a one-time cleaning for these facilities. And it has to be in line with CDC guidance, has to, FEMA's not going to pay for if your town hall was abandoned or was closed for, 3 months and you cleaned it after no one was in there for 3 months. Doesn't make sense, right? So just, have a little tact with that. We will help you navigate through all of that when the time comes for your project worksheets. We definitely will be asking a lot of questions because FEMA will be asking a lot of questions. Technical assistance to state, emergency management on control of immediate threats. So that's just what if you bring in a consultant to kind of help you, control it. EMAC was a really big one, or state mutual aid agreements were really big. Would be really big for this bullet point, but I don't think anyone's doing a lot of that nowadays. So if you had to bring in any help to, control the immediate threats, like more, I know I've seen a little bit on police staff augmentation for traffic control for testing sites, that kind of thing, that will be eligible. Emergency medical care. This probably isn't going to be a big one for most of you unless you have a public hospital that you own and manage. This is going to be a really big one for hospitals. It will be relevant for your EMS folks out there. The transport of COVID-19 patients, any emergency treatment that they received while transporting, that sort of thing. But if you have any, if you have more questions on the emergency medical care, feel free to pop them into the chat and we can talk about them. I don't want to spend too much time because I just don't think that's going to be a huge one for most of you. Medical sheltering may not be a big one for all of you, or it may be just non-congregate sheltering in general. We have been approved for non-congregate sheltering for a host of different populations, everyone from, suspected to COVID-19 to our emergency first responders. I think a lot of you are doing more of a hotel setup, so that will be eligible for reimbursement. Household pet sheltering, probably, again, non-congregate sheltering, that's just going to fall in line. Purchase of distribution of food. So I know a lot of you are doing emergency food operations. We have been approved for emergency food operations. So if you are doing emergency food operations, a couple of words there. You want to make sure what populations you are documenting. You want to document what populations you are serving with that emergency operation. I would love to see, on an application that it was, really geared towards the elderly and those who are autoimmunocompromised and those who were suspected or confirmed COVID-19. Just make sure to really tighten that up. And again, the purchase of the food, if you transported it, if you had like a Meals on Wheels situation, that transport cost is going to be eligible. Movement of supplies or persons, we can imagine this is a huge logistics mission, going to be eligible. Security and law enforcement, we've really seen this related to testing sites. So obviously we want crowd control. We don't want people just, surging into the testing sites. That's where we've seen a lot of the security and law enforcement. We definitely get a lot of questions from FEMA when towns claim overtime for enforcement of curfews or enforcement of if there's protocols or gathering limitations, body limitations, gotten scrutinized on that. So just make sure that you're tightly relating this to COVID-19. If you have a public health order from your local health official that, puts some of these things into effect, that's certainly not going to hurt. So we want to see it all. And then communications on general health and safety. If you have a public information officer and they've been working nonstop to, just get out all the communications, hitting up your Twitter, your Facebook, their time will be eligible for reimbursement. If you hired someone like a PR firm to do that for you, we have been running into cost reasonableness issues. We don't want to see PR firms that were contracted to do, for $1 million just to do a couple of Twitter updates or Twitter feeds. So just be mindful on that. I don't think that's going to be an issue for the majority of you, but just be careful. On that note, we have seen a lot of costs related to like not teleprompters, but the you put them on the roadside and they have messages on the roadside for drivers to acknowledge. We've seen a lot of purchases of those recently, which isn't a bad thing, but we will be asking a lot of questions as to, could you not rent them? Could you not request them from the state or, the state DOT? They have, millions of them in stock. So just be prepared if you did, get like a roadside message prompter and you bought those, we will be asking questions. So just be prepared to answer those. Search and rescue, not a huge issue for this disaster. It's mostly been medical transport. And reimbursement of overtime costs. So if you're, the majority on this call are probably the emergency managers for your municipality. Your overtime is most likely going to be eligible for reimbursement if you have been exclusively working on the COVID-19 response. And again, overtime for any individual in your municipality that has been responding to COVID-19. And again, that does not include routine functions like your finance person who's just been, continuing doing the payroll or continuing to, put together the budget. That's most likely not going to be eligible for PA reimbursement. It has to be very closely tied. And I know we have been getting a bunch of questions on the chat. I love it. Keep getting those questions in, especially as we are going to go into the post-September 15th guidance. So post-September 15th guidance was issued September 1st of this year. And it does tighten up, makes a lot more specific what costs FEMA is going to reimburse for. And again, like we talked about last time, you have to have the legal responsibility to perform that activity. Again, I don't expect that to be a huge issue for municipalities. It will be a larger issue for the private nonprofits in your jurisdiction. So the first one, medical care, probably not going to be a huge one in your jurisdiction just because, unless you do EMS, just because you guys most likely don't manage or own any hospitals. Food operations going to be the same. Just make sure that you tighten up which populations you're serving to make it as easy as possible for us to seek reimbursement from FEMA. Non-congregate sheltering, again, Commonwealth has been green-lighted to go forward. Any of your operations in your EOC is still going to be clear. Your communications for public information still going to be good. But again, we want that communication to be public health related. If it's communications like just a bunch of posters on where you've relocated your DPW, most likely not going to be eligible for reimbursement. We want that public health messaging to the public. Mass casualty management. We have seen a lot of unfortunate burials, a lot of grave sites that is eligible for reimbursement, as well as PPE. So again, PPE was eligible pre-September. It's just now it's really reiterated in this guidance. it's definitely, we get into a lot about the stockpiling of 60 days, a lot of questions still about that. How can we show it? But it's really the biggest thing for you guys on PPE is it is only going to be eligible if it's given to folks who are performing eligible emergency work. It is not going to be eligible if you gave out PPE to the general public. It is not going to be eligible if you gave it to school teachers or kids going to school. It is only going to be eligible for those first responders that are responding directly to COVID-19. I know I'm going to get a bunch of questions on that, so feel free to pop those into the chat. And then going more into the post-September 15th, again, just really hammering that the purchase of face masks only going to be eligible for people performing eligible emergency work. Temperature scanning only going to be eligible for those performing eligible work. Disinfection of facilities only going to be eligible where emergency work is performed. And the acquisition and installation of temporary physical barriers, we've seen a lot of plexiglass, only going to be eligible where emergency work is performed. So a lot there. So let's unpack it a little bit, right? Popular issues we've had with this include you have your town hall, right? And you have the general public going in and out. You want to install some plexiglass in there to provide some barriers. Not going to be eligible unless that's, where maybe your EOC is. It's not going to be eligible just because you're not performing emergency work. You're doing routine functions in there. That's going to go for your disinfection too. It's not going to be eligible for any disinfection unless you have a suspected or confirmed case of COVID-19 there, which we have seen quite a bit of. And this is really most prevalent for schools. So according to this guidance, if, let's say you have a school, you have a teacher or a student that is suspected or confirmed COVID-19, FEMA will reimburse for the cost of disinfecting that facility within CDC guidance. So keep that close to the vest. Make sure you're tracking your staff, make sure that, if they're reporting that, they have COVID-19, and you clean the facility, just keep note of that, keep track of all that stuff. And then again, just going into the rest of this, law enforcement security, training, technical assistance, reimbursement for force account labor overtime costs, the logistics, and then other work and costs delineated within COVID-19 policies referred therein. So if you want a copy of the completed, we kind of did some very convenient snapshots for you so that we didn't have to go over the entire guidance. That guidance is located here, just a quick, easy click. And again, if you have any questions, please feel free to pop them in the chat and we will get to them shortly. Documentation requirements. This is a great one. So most of you should have had your exploratory calls with your project coordinators. If you have not, please schedule them. You're going to learn a host of really great information in that call. You should know then that there's a difference between a small project and a large project, meaning the dollar amount of that project. So if you have a project that is less than $131,100, you're going to need this documentation. So you're going to need to fill out the streamlined project application, which you can only fill out in Grants Portal. We do not want emailed copies of the PDF. We don't accept those. It has to be done via Grants Portal. We're also going to need a MEMA workbook. The MEMA workbook is available on the MEMA website. Your project coordinator should also have emailed you a copy of this as well. It's a really great macro-enabled workbook. That line item just takes down all of your costs. It's really great workbook. We will need it with your project submission. Subrecipient small project certification form. For each small project, we are going to need that certification form. That form simply states that you are aware that you do not need to provide any source documentation. You can see this list is a lot smaller than this list. For a small project, you do not need to provide source documentation. That you understand that if we ask for it, you must provide it for audit reasons. And a couple of other assurances. That again is also available on our website. We will also need your procurement policy. If you have one, we have seen a lot of municipalities say that they refer to the state's procurement policy. That's fine. We just need to get that in writing. And then we also need your pay policy and applicable union contracts. We want to make sure that there's nothing hinky in there, such as, your emergency manager only gets overtime when there's a federally declared disaster. That is an issue that we need to monitor for. So that's all the documentation you need for a small project. Super easy, super simple. Now let's get into the large project, right? More money comes more responsibility, right? So if you have a project that is over $131,100, we're going to need a little bit more. We're still going to need that streamlined project application. Again, that will be done via Grants Portal. We're still going to need that MEMA workbook. And again, it is a macro-enabled Excel workbook that is, it's pretty handy. I think you'll be, if you work with it a little bit, there's a video, there's a tutorial. It is intimidating. You can't copy or paste into it, which I know does frustrate a lot of applicants, but it is rather easy to work with once you get the hang of it. Procurement policy, again, similar to the small project. Your pay policy and applicable union contracts, again, same as the small project. But here we're going to get a little bit different. We're going to need all of your source documentation. So if you're claiming overtime, we're going to need to see timesheet, any payment logs that you might have to accompany that, as well as proof of payment. For proof of payment for timesheets, usually a payroll register will do. Force account equipment. Let's say you already had an electric bleach sprayer and you use that to, disinfect your EOC every night or something, or, you just use that to clean eligible buildings. We're going to need proof of ownership and then the timesheets and logs. And then FEMA on their force account equipment, they have a whole, it must be thousands of lines of all the equipment that they'll pay for and their hourly rates that they'll charge. And that is conveniently already in the MEMA workbook. So just a little plug there. If you, bought PPE, you bought food, you bought water, we are going to need to see all of those invoices and receipts. And then we will also need to see the proof of payment for that, whether that's a canceled check or a payroll or a bank statement. We're rather lenient with that. We want to work with you. We understand it's a pain to get proof of payment, but we will need that. And then last but not least, contracts. Let's say you hired a vendor to clean for you, to clean your facilities. We're going to need to see those contract agreements. We're going to need to see those invoices and receipts. If it was competitively procured before the disaster or even after the disaster, we're going to need to see all those bid tabulations and all that good stuff. The procurement documentation, I was getting ahead of myself, apologize. And we'll also need to see that proof of payment. I know it sounds overwhelming, but we will help you along the way. We will also be reviewing your project before it is submitted to FEMA so that we can, one, make the best project possible for you to make FEMA's job super easy, but then also to make sure that we're not missing anything. So I know we do issue a lot of requests for information. Bear with us. It's just so that we don't give FEMA something that they cannot work with and they have to issue an RFI of their own. Again, if we have any questions on the differences between what documentation requirements are needed for a small project versus a large project, let me know. EHP, environmental historical preservation, hasn't been a huge concern in this disaster. I know, if anyone has any beach projects that they've worked on in the past. They'll be like, oh, EHP. Not a huge issue for this disaster. EHP will only get involved if you have hazardous materials, so like needles and like medical waste. They want to know how you're disposing of it. Or if you are installing plexiglass in a facility where you are performing emergency work and that's a historical building, they'll want to know a little bit more about that as well, but not a huge issue for this disaster. Okay, and with that being said, we've come to the end of our presentation. We'll go ahead and start taking questions. Go ahead and open my chat. Ooh, and we have quite a few. Let's see. And again, this presentation will be, I think I saw someone ask if we could email out the presentation. I do believe we have the ability to email. I think we do collect your emails if you did join this presentation. So we'll look into that. And if we can, we will. If we can't, it will be made available on our website. Let's see, getting to the first question here. Apologize. Can't hear anything. And also, we will be taking track of all of these questions, and we will also be posting these in an Excel format on our website. So the first question from Mr. Young. Municipal CARES Act eligible expenditures are through December 30, not 31st, right? I am not, it looks like Thad did follow up saying we're working very closely, we'll coordinate with them. We'll go ahead and take that as the first question to follow up on. We don't want to give you incorrect information if it's 30th versus 31st. So we will confirm that with ANF. Next one from Miss Benay Roden. My reimbursement request went in. I was told I could not get reimbursed for admin costs for preparation and gathering of documentation until declaration is over. How is that handled if disaster is not closed before 12/31? So you are able, sorry, go ahead, is requesting to annotate shared, sorry. I apologize, someone gave me an annotation request and I'm going to go ahead and decline just because I'm not exactly sure what that means. So going back to the question, so you can get management costs, and that's through what's called Category Z project. We have seen quite a few applicants try to put that into their Category B projects, which we don't allow. It has to be a separate Category Z project. But your cost for management, your management costs, you can get reimbursed for up to 5% of the total eligible amount. So let's say at the end of the day, your town ends up getting $1 million for FEMA PA. Awesome. You can claim, and let's say you hired a vendor or you had a staff member work full time, you hired someone to specifically work with this grant, you can receive up to 5% of that $1 million so you can receive up to $50,000 in management costs to pay for that help. That being said, you can go ahead and submit for those management costs whenever you like, but it has to be submitted as a Category Z. And I'll make sure that your project coordinator gets with you to show you how to request it as a Category Z and not as a Category B. Next up, what is the name of the other source of funding we can speak to our representative about? For the MEMA project coordinators, we specifically and exclusively deal with FEMA PA. But if you have questions on CRF and how PA interacts with that, you can definitely send that to your project coordinator and we will coordinate with ANF to get that answered fully. That was really confusing. Can you please provide the explanation of CARES and FEMA in an email? We can definitely, I'll reiterate what I said as a response to your question. No problem. Again, if you have costs that you want to seek CRF funding for, but you think it might be eligible for PA, go ahead and send an email to your project coordinator with those costs, and we'll send you a memo back doing an analysis. That's pretty much what that whole spiel was about. ANF is telling my finance director to have a submit for PA assistance, even if our MEMA rep says that the items are not likely to be eligible. That is a lot of work. If you want to go ahead and send me an email, Mr. Wright, exactly on the expenses, we can work with ANF just to see what the issue is. And I can do a memo myself just to make sure that the point gets across. But it should be if your project coordinator is telling you that these costs will most likely not be eligible, that should be good enough. But sometimes ANF may want you to still seek reimbursement, but we can definitely take that offline. I agree. Why bother submitting when you know those expenses will not be reimbursed? We agree with you, Ms. Johnson. We don't want to waste your time. ANF doesn't want to waste your time. We want to make sure that you guys are getting the funding that you need from the appropriate source, and especially given the time sensitivity of the CRF. Amanda just indicated to reach out to your MEMA rep to discuss those costs that will likely be ineligible. They can prepare an email for you. Okay, great. Thank you, Mr. Wright. Appreciate it. Or Mr. Stevens. Thanks, Jeff. Appreciate it. I believe we can apply from Mr. Barclay. I believe we can apply the 25% share not covered by Stafford to CARES, correct? I believe that is correct. See, one of the eligible costs for CRF is that non-federal cost share for PA, but we will confirm with ANF and include that in our Excel sheet. Let's see, next question. When will we hear what FEMA has accepted on a project filed by October 15th? It ended for us October 14th as requested by MEMA at that time. We can definitely, Ms. Herman will definitely check on your entity's project and see where it is in the process. I know we do have a bunch of requests for information out. So if we did issue an RFI to your entity, you know, we're then waiting to hear back from you guys on that information that we need. But I'll follow up personally to make sure to give you an update of where that is in the status. Amanda, could you please send out PowerPoint presentation to all after your call? So again, I'm not sure if we have the capability, if we are able to gather all the email addresses from everyone on this call. If we do, we will definitely be sending out. But if we don't, we'll just have to put it on our website, and we'll do a blast email after this to all applicants to make sure that they know this is all available on our website. Wasn't that guidance change for September 15th, not October 15th? I apologize if I said October 15th at some point. It is September 15th. So it is in effect for September 15th going forward. Apologies if I said October 15th. I can't believe it's December 2nd. So I do apologize if I said October instead of September. The application to CARES assumes what will be covered by FEMA and thus takes out 75% it thought to be covered. That is correct. When will we get approval on submitted expenses? We can't correctly apply to CARES Act until we know what dollar amounts are still unpaid for through FEMA. So it depends if you've submitted your expenses. It just depends on what documentation is still needed. I wish I could give you a timeline on when we submit it to FEMA, when it will get obligated. FEMA themselves, once we submit it, they might have their own questions and that just adds to the timeline. But I would definitely urge you that if you have costs that you believe will be ineligible for FEMA PA, to contact your project coordinator to make sure that they get you that memo. The response we've seen from MEMA is that certain costs are likely to be ineligible, but the CARES template automatically nets out 75% of certain categories of costs if we know those costs will not be eligible for FEMA. These costs tend to relate to cleaning safety measures, air filters, plexiglass for non-public safety buildings. That is correct. What if town hall encompasses the EOC, police, and DPW? That's a really interesting one. I don't know, Bruce, if you have any thoughts. I don't think the 50% rule would apply. But I would suspect to, and Bruce, I'm going to unmute you just in case you want to pipe in here. I would suspect that the costs are still going to be limited to, what you use for the EOC, what you use for your police, and that it will not be eligible for, your town hall employees that are doing routine activities. But Bruce, do you want to chime in?
Yeah, hi, Amanda. First of all, thank you very much for allowing FEMA to join in, and we appreciate you reaching out to your applicants, because obviously clarification needs to be needed on a lot of these questions. I believe you're absolutely correct. If indeed you have an EOC, or let's say your police station is also in the same building, we would confine it to those areas, the disinfecting. So the EOC, and again, it is when you have a suspected or confirmed case. We're not going to do a daily cleaning of your police station and or your EOC. It would be, or disinfecting, should I say. It would be if you have a suspected or confirmed case. So that would be, you hit the nail on the head, I believe.
Awesome. So we'll also make sure to tighten that up for that response too. But thank you, Bruce. I appreciate you joining us as well. Great. Going forward, and just to be respectful of everyone's time, we have 7 more minutes on the clock. Again, if we don't get to your question, we will be following up in that Excel document. So do not worry, we will answer all of your questions. It would be nice to know all those other buildings would not have been eligible for Smith costs. Sorry. Let's see. Next question. Why doesn't it specify that before we spend? Okay. FEMA will allow that one-time exception for city facility cleaning post 9/15 or just pre-15. That will be only pre-15. Post 9/15 for facilities where non-eligible emergency work is being performed. Cleaning will only get reimbursed if there is a suspected or confirmed case of COVID-19. I think that answered that question. Will costs related to cleaning of congregate shelters set up to reduce spread of COVID-19 in the community be eligible? So again, just taking some assumptions here that the congregate shelters. So I don't know if you meant non-congregate shelters, but again, if that shelter is run by the town, and it is serving the populations that we have been green-lighted for, such as people with COVID-19, emergency first responders, those populations, then the cleaning should be eligible for reimbursement. And again, we'll put those assumptions in that Excel sheet, but also address if it is a congregate shelter and whether or not if a private nonprofit runs it, we'll also make those assumptions in the Excel sheet question. Are Department of Public Work employees considered essential workers? We've gotten this question a couple of times, and it falls back to, what are they doing? right? Are they actively responding to COVID-19? Most DPW workers, are just doing their routine functions of, doing construction projects, maintenance projects. Those most likely will not be eligible for reimbursement if they're given PPE. Even if they go, house to house doing, electric meter checking or something like that, that is a routine function. That is not a, response to COVID-19. That most likely will not be eligible. Has anyone been reimbursed for school supplies because items such as scissors, markers, crayons can no longer be shared? I was told no by CARES, but I feel like this should be reimbursed. We have 2 elementary schools and they really can't absorb this. Kids used to be able to share supplies, now they can't. I don't see why these items are not allowable for reimbursement from CARES thoughts. So I'm not sure about CARES, definitely not going to be eligible from FEMA PA. We will coordinate with A&F to get just a good response from them on this question. Yep, not sure, but please feel free if you would like to discuss in the chat to do so. What is the recommended course of action if cleaning of town hall school was included in the first CARES Act application approved and paid out with the assumption that it was FEMA eligible? At that time, there was no guidance stating otherwise. I would definitely suggest reaching out to A&F to see how that can be rectified, because that would mean you only got 25% rather than a larger amount. I would definitely reach out to A&F just to get their guidance on how they would like that to be reconciled. How about municipal self-funded employee health insurance payments for COVID testing and treatment of COVID positive patients? So health insurance payments, testing from an employer standpoint is not going to be eligible for reimbursement unless it's included in their fringe benefits. So you do get included. So, premiums are included to a certain point with the fringe payments benefit calculator that is included in that MEMA workbook. But any insurance payments for your staff directly will not be eligible for FEMA PA reimbursement. There might be other avenues that's more of like a, an SBA, not really even SBA, but like a small, wouldn't even be small business. We'll do some research on some alternate funding sources for you for this activity, but it's not going to be FEMA PA. I did not meet the 300 minimum expense before the September 15th deadline. Can I add them and do post September 15th? Yes, you can do that. Best practice, we do want to try and keep the, pre-September 15th and the post-September 15th costs separate. But if your entity did not meet that minimum $3,300 minimum for a project, you can certainly combine the 2 periods. That is not a problem. Second, I bought items for school needs for increase in emergency go kits with the additional learning spaces and also coolers and ice packs when the school was mandated to send meals home. Are those reimbursable? So most likely not. There's other funding sources through the USDA for school meals. We have seen some pushback regarding schools offering feeding to its population during the summertime. It's seen as an increased operating expense or might be seen as being, under the realm of USDA funding. So most costs will most likely not be eligible for reimbursement under PA. What about overtime costs to backfill police fire for people that have been exposed to COVID-19? This is one of my favorite questions, but like with the worst answer possible or just an unfortunate response. So let's say you have Bob is a firefighter and he's, working, he gets COVID-19, he's out. So the town has to bring in Sam to backfill for him while Bob is out with COVID-19. Unfortunately, backfilling is only eligible when Bob, that first person, is doing an eligible emergency activity. So we see this a lot when Bob gets requested to respond to a fire or gets asked to respond to an emergency in a other county that's still designated for public assistance, and Sam has to go in and backfill for him to keep doing his routine activities. Unfortunately, if Bob is at home with COVID-19, he's not performing an eligible emergency activity for Sam to backfill. It's a hard pill to swallow, but it's not going to be eligible. Let's say instead Bob was a policeman and he had to go, do security at a testing site, and Sam came in to backfill him, that would be eligible for reimbursement. But again, it's if you have folks that are, a homesick with COVID, it's not going to be eligible, unfortunately. What about PPE purchase to cover potential shelter operation? That's a tricky one. My first, and I'll go ahead and unmute Bruce. My inclination on this one is just because it's, you can't provide PPE to the general public. It has to only be for emergency first responders. So I would assume that the PPE purchase will most likely not be eligible for shelter operations. But Bruce, what are your thoughts?
Yeah, I mean, by the sound of it, you're talking about congregate sheltering, in which you're exactly right. PPE would not be eligible for that type. If you're talking about medical non-congregate sheltering, then there is the possibilities of reimbursement for PPE on that.
Awesome. So if you are, it is a potential shelter operation, just keep that in mind if it is a medical non-congregate sheltering. So more of, a hotel situation, or hospitals have, may have temporarily leased a facility to house folks, that may be eligible. Thanks, Bruce. Sorry. Is the school nurse considered an emergency worker since she's screening students, staff, and doing tracing? We're still in school, not 100% virtual. We've had this question before from FEMA, and we've gotten a no on that. I'm going to unmute Bruce again just to make sure that that's also his opinion. We have gotten a no on school nursing staff. Unfortunately, Bruce, do you have any different feedback on that?
First of all, tracing is not eligible. So that's right off the bat. So is a school nurse considered an emergency worker since she is screening students and staff? Still in school, not 100% virtual. That's a really good question, actually. And to tell you the truth, I don't have a confirmed answer in my head, so I'm not going to give an answer at this point. I will write down the question and I'll get back to you, Amanda, on that.
Thanks. And Ms. Shaw will go and we will follow up and make sure that is included in the Excel sheet for you. Next up, and again, we are overtime. Okay, sorry guys, I didn't mean to go overtime. We have quite a few questions left, so I'm going to go ahead and stop there. Yeah, we have quite a few questions left, so I'm going to stop there. Again, we will be sharing this presentation and the Excel sheet that will have all the questions and all the responses to those questions on the MEMA website. And we will, if we can't do a direct email to all the participants in here, we will do an applicant email blast so that you guys have that information. But again, thank you so much to everyone. Thank you so much to Bruce from FEMA. As Thad articulated earlier, FEMA Region 1 has certainly been a great partner during this time. And just as you guys have been as stakeholders, we really appreciate your patience. We appreciate your dedication as civil servants. So thank you, everyone. And I hope you have a good one. And again, be on the lookout for that email. Have a good one. Bye, everyone.